We are at the Sacred Heart Griffin High School football press box, where we're going to have high school football later on tonight. But to start off today's press box, after the Cardinals' 2-1 victory over the Chicago Cubs, we've got Dr. Chris Wadawa, board-certified orthopedic surgery and orthopedic surgery of the hand. Dr. Wadawa, he's with Springfield Clinic Orthopedics. Dr. Wadawa, talking about hand injuries today, and we've got one that's kind of front and center, the Drew Brees injury. What happened on that one?
I didn't see it, Roop. I know I read about it a little bit. He had what's called an ulnar collateral ligament injury, which is it's the most common ligamentous injury in the hand, and the thumb, of course, is a little bit more exposed to that because it's away from the other fingers. And what happens is basically your thumb is pushed off your hand, and if you push your thumb and your index finger together and pull them apart, it's the ligament that joins the two major bones of your thumb together, and every time you pinch or grip, if you don't have that ligament, your thumb just keeps on going. So it's a pretty important ligament. What's
the treatment for an injury like that, Doc?
Well, I mean, it depends. It sometimes it's just a sprain you can splint, and if it's a complete tear, there's a little bit of controversy over whether or not you operate early. I tend to operate early for this because there's a certain percentage of them where it's completely torn off, and another piece of tissue can get between the ligament and the bone, and it doesn't heal right. And the longer you wait for that to be discovered, the worse it is. So most of us are pretty aggressive about getting in there and repairing these anatomically. The funny thing is with Drew Brees is, they keep saying 6 weeks he'll be back. 6 weeks the ligament may be healed, but 6 weeks his ability to grip a football is going to be pretty diminished. He's not going to be Drew Brees of 2018, 2017.
Dr. Waddle, what does the surgery entail? Is it like do you have to take a ligament and tie something in? Do you have to take something from somewhere else? Or how detailed is the surgery?
It's pretty easy. I mean, give me a couple hours, I can have you doing it, Roop. We can get a couple of tools out. You don't, if you get there acutely, and, he had injury 10 days ago, and within 3 or 4 days he had the surgery. If you get there within the first 4 weeks, you can use the patient's own tissue, which is one of the reasons we're a little bit more aggressive. After about 4 or 5 weeks, it starts to get tough, and you have to grab a tendon from someplace else. What they're probably doing with this, the guy who did it is a very sharp guy out of Los Angeles, Dr. Shen. He's with the Curlin Job. Job is the Tommy John guy from the 1970s, did the first one in 74. And what we're doing now is, for the thumb, is what they're doing now for some Tommy John. They're doing an internal brace. So we use an anchor that uses a band of synthetic tissue made out of Kevlar, actually, and that will help support the thumb while the native ligament heals. So the patients are getting better faster. They're returning to sport faster, but 6 weeks is pretty optimistic for a high-demand quarterback.
For quarterbacks, is this a fairly common injury, or is this something that you don't see very often?
No, it's what we call it a skier's thumb. It's common in skiers. I've seen it in a couple of football players. I've seen it in wrestlers. Yadier Molina missed a good part of last season, I believe. With initially he had a nutritional injury. They tried to repair it directly. That didn't work, and they had to go back and do it again with the graft, I believe. So he missed 5 or 6 weeks the first time. It didn't work, and then he had to miss about 2 or 3 months. And that's pretty much the norm. I've done this in some people where it's a year before they feel 100%. You can do things, but high-demand things are tough.
Throwing a football would not be on the list of things you could probably do in 6 weeks.
My friends who are Saints fans do not like to hear me talk about this. They don't like it at all. He's back in 6 weeks, and that's it. And again, he may be back. In the pros, they do weird stuff. They'll inject you with local anesthetic and let you play for 3 hours. That's a possibility, so it doesn't hurt. That's crazy in my world, but in the pros, that's what they do.
Dr. Wadawa, thank you very much for your time this afternoon. Dr. Chris Wadawa from Springfield Clinic Orthopedics. Going to take a break and come back for more on the Press Box.